Well, Niger Foundation Hospital started in 1993 after the visit of Bishop Alvaro to Enugu. He mentioned about the need to start some kind of social work which would help the society. And so we took it up, and after a lot of struggle, we managed to get a piece of land, and we started building. At the same time, we started the hospital at a temporary site in a rented premises, which was adapted to suit the needs of a hospital. This hospital, as it is, was built in stages. The laboratory was started first, and then later on the hospital proper with the outpatient and an inpatient facility. With time, the facilities in the hospital kept on improving, and at present we offer all the basic needs for good quality hospital care to patients. This is one of the reasons why we have many patients coming to the hospital, because of the quality care that we offer.
Our nurses are very good professionals. Hundreds of people are applying every month, and after careful selection, we ensure that they go through training. Training begins with each individual nurse that assumes duty here. They work directly under charge nurses and supervisors, even on a day-to-day basis. And then every week, the nurses gather to learn about how to improve in their skills as they work on a day-to-day basis. The supervisors, alongside the matron, go a long way in teaching and training at various lectures that are being given. We do that every week. To facilitate the recovery of our patients, we emphasize teamwork. Every worker in the hospital works well with every other worker.
We have a lay-down principle in Niger Foundation Hospital that guide our care of patients, giving them personalized, individualized care so that they will be happy when they are leaving. And we try to welcome them cheerfully and always try to also put back the smile on their faces.
Many times, they turn out to be surgical case at the end of the day. But there are a lot of nursing care that are needed to really keep them going, especially hypertensive patients and end up having CVA and become unconscious. So it involves a lot of turning, checking the vital signs, and they may be on oxygen, which you have to continue monitoring to see that they are taking the accurate dose, and checking if oxygen is over and is empty so that we can change the cylinder for them. At the end of the day, many of them go home happy.
The environment is friendly, and we have always been provided with everything we need to work with. So we have adequate staffing, nurses, and then in the wards, the follow-up of patients after operation is also satisfactory. We do a variety of operations. There are 2 gynecologists presently here. Then I do general surgery and cardiothoracic surgery here. Then we have 2 urologists also and an orthopedic surgeon. On the average, currently, in a year, we do about 1,000 operations here.
The laboratory is doing very well. All the various disciplines are covered: bacteriology, parasitology, chemical pathology, hematology, histopathology, bacteriology. And so all the tests are virtually run here. Patients are happy with the results of the tests. The turnaround time is very short. We do tests, and within a few hours, the results are released. And virtually all the tests are done here. In chemical pathology, for instance, we have various types of immunoassays done, the hormonal assay, the PSA, all the routine chemistry like LFTs, urea creatinine, and so on and so forth. Hematology is done, every test they are covered, We have the machines, the analyzers, all these things are automated, so within a short time results are released. We have external quality assurance, we have internal quality assurance. We have a way of getting samples from outside where you run, compare to control your reagents and your equipments. You have your own internal quality assurance. So when you are doing that, you will be sure that the results you are getting is well, because it's comparing very well with outside tests.
We take care of women both when they're pregnant and when they have other problems apart from pregnancy. The pregnant patients, since I started working, we've had an increase in number. Every antenatal clinic day, we see approximately 35 patients. The women keep coming back precisely because the type of care we give them, they like it. Apart from the specialist care that both the midwives and the specialists, the obstetricians, gynecologists give them, the hospital is clean. They usually comment that the hospital doesn't really look like what other hospitals look like in terms of the cleanliness, in terms of the comfort. The hospital has the way of looking like a home. And over the past month, on the average, we deliver about 10 babies per week. And our antenatal patients are really very happy. Most patients who start having their first babies here, they complete their family, they tell their friends, and it's like a family affair. With regards to the gynecological patients, we have patients of different problems. We have those who have infertility as well as other gynecological problems.
The facilities department has 3 units: the kitchen unit, the laundry unit, and the housekeeping unit. The kitchen unit is in charge of making sure that food is supplied, especially those of special diet, that they prepare such diets and supply to patients at the appropriate time. They have a menu that helps them to know the food to be prepared, and also they make sure that they come on time.
We cater for about 130 to 140 patients per day, and the information about the meal or diet given to each patient is supplied to the kitchen daily. We grill instead of frying, we poach, we steam, we boil, so that we'll be able to retain maximum nutrients from the raw material we use for the preparation of the meals. We get our food locally because it is fresh. We prefer to prepare food that is fresh. Yeah, the patients are usually very happy. Most of them, when they are discharged, they will be coming to the kitchen to request for the ways we prepare.
Then in the laundry unit, they are in charge of making sure that all the linen necessary in the hospital are supplied. The bed sheets are used for the patients in the ward. The draw sheets are used for various couches. And also, materials that are needed in the theater are supplied. The materials also needed in the X-ray department and the ultrasound department, they supply all these materials as requested. Many times keep them for emergencies. The entire hospital is kept clean by the housekeeping department, making sure that each room is kept very clean for the patients at the appropriate time, using the appropriate chemicals and other controls and air freshers to make sure that the environment is perfumed properly. And they make sure that both the tiles, the height, cobweb, the fans, the furniture, all are kept very clean. And it attracts patients a lot to make sure that the environment they are kept very, very clean.